it's made my life like 100 times better since being able to be like, let's just go straight ahead and think of what I have to do and do it. And I have all the other kind of supports in place. People, it's not just the medicine,
Yeah.
right? It's the supports I have in place. My wife who yells at me for stuff. Like, love her to death, but she needs to yell at me for stuff to get stuff done, and it works, right? I have assistants that I've hired to kind of give me, for my private practice to like go through my messages, give me a to-do list, tell me what I need to do, send me the to-do list, and I'll just do it. Boom. You think I'm going to be like going through emails and phone calls and somebody give me the stuff I need to do and just tell me to do it. Give me a checklist. Boom.
There you go. Brother,
Yeah.
I just got done paying like 4 or 5 medical bills the other day and some other shit. And I called the one, I couldn't fucking pay it because the link didn't work. And then I had Colin run the link and then the link didn't work. And so then, it's been months now. And I called them fuckers finally yesterday. I was mad. He says, we done sent you to collections. Collections? I haven't sent to collections in 10, 15 years.
Yeah.
Collections.
Yeah, this was happening like all the time. I had stuff in collections for like $10 for like an easy pass that I missed, or like a toll that got missed that like goes to collections for years, right? And it's like, what the fuck is this, right? And this is why I can't buy a house, right? because of stuff like this.
We're not gonna get into your demons right now, Doc.
Strikes again.
We're not gonna get into your gambling addiction.
A snowflake addiction.
Betting opponents. I can't stop.
Won't stop.
Do you find any like different age ranges easier to work with? Like you said you're like a big kid. Do you find it easier to work with teens? Then you'd be like, or do you feel like adults are like your mainstay?
It's they have their own challenges. Every age group has their own challenge. Anybody who works with who doesn't work with children and adolescents, I'll say this like in the medical field, and they'll all tell you the same reason is like, because I don't want to deal with the parents either, right? Because they'll say the parents are the hardest people to deal with when you're working with children and adolescents. I look at it as like a child, and it's its own challenge in a way, because sometimes they can be the greatest supports, but they can also be the greatest trauma bringers for these kids, and they can be the greatest obstacles, or they can be the greatest enablers for them, right? So it's a mixed bag. I like that aspect. I like working with children and adolescents more, and that's why it's my main gig. Why it's where I spend 80% something of my clinical hours is over there. Is because I like the idea that I can really intervene early and change trajectories of life. That's the biggest thing, because a lot of times with adults it's like I hate to say it's like almost the damage is done in a way. It's really hard to unlearn a lot of habits and strategies and ways of being.
It's tough.
And with children, adolescents, you see whole lives that are literally just saved by the field. Where the thing that got me into it as a med student was I had seen this kid who had been terribly, horrifically, abused, right, by family members. All this stuff was terrible. And she was ultimately adopted by this gay couple, and by the time I was seeing her as a student, she's having normal 12-year-old girl problems, and I'm reading through the chart, and I'm getting an idea what's going on. Oh my god, if I had this life, I don't think I'd ever be able to go on and live. But here she is, a second chance on life, getting the help that she's been supposed to begin, doing well, and again, normal 12-year-old girl problems. You couldn't ask for anything more than that. And I was that's what sealed the deal for me. That was oh my god, this whole girl's life has been changed and saved.
I agree with everything that you said. I love working with that. That I started private practice. Now I'm going younger and younger and younger because I'm getting more comfortable. So the youngest I got is some 13-year-olds, but I feel like it's a lot of freshmen, 16-year-olds. I'm getting stuff like that, and parents are getting in the way of some stuff, right? And then I'll send a message to the parent, like, hey man, you're gonna have to back off your kid. And they give me this long fucking list of the reasons why they're hard on the kid. I'm like, I'm just letting you know your kid's gonna cut you off in a couple of years when they go to college. You can shit off, get off. I don't really care what you do.
Yeah.
So that's been difficult.
Yeah.
My biggest joy is working with the kids, but I tell you, I've had some recent breakthroughs with some adults. and you heal some of them old trauma wounds. And
Oh,
man,
yeah.
I had someone cry, grown ass adult, 2 hour crying. That shit was
Yeah.
wild. And I know them for months now, and they finally broke. And I'm
Yeah.
like, Jesus, kid, where's this been?
Oh, yeah.
So I think we finally did therapy. And then I said, I think we finally saved your life. Now we can start doing real shit. So those are great moments, but it's tough with adults.
Oh, yeah.
I got a question for you when it comes to working with folks with addiction. You said some of your stuff is like working addiction work. That's a struggle. A lot of my addicts are struggling right now. Alcohol, other drugs, intravenous drugs, shit to get in the streets, black market. It's a tough population, man. There's a lot of recidivism in that and like relapsing. It's tough. So what is your role? Not how do you do, what is your role as a psychiatrist in addiction recovery and treatment?
The biggest thing is really looking at what works and what doesn't work. For lack of a better term, when I was in training again in school, and even like in psychiatry residency and the training that goes on over there, our substance abuse rotation was like this throwaway rotation, right? We were working at the VA and that was part of our 4-week rotation. And when I got married during my residency, and they're like, that's the time that you're going to get married, and that's when you're going to take your honeymoon. We're going to arrange it so that you can just miss the time because don't worry about it, right? And they're like, sit in for, then during the 2 weeks, they're like, sit in for, an AA meeting that they have at the VA, and just get to know the people because they're going to be a revolving door.
Mm.
And that was kind of like the approach, was like, these people never get better.
Mm. And
I'm looking at it and I'm just like, there's something else. There's got to be something else, right? Because all of the fields of medicine, they shrug off substance use and substance use disorders, and they throw it onto psychiatry. And they're like, oh, this is a psych problem. And even then I was saying that, like, even with psychiatry, I was like, we were seeing it as like a throwaway thing too. This thing you just don't worry about, or it's a hopeless thing to do.
Yeah.
So the models that were in play, go to AA, go to detox center, right? That was like what you're taught. Go to AA, go to rehab, right? And you'll be all better. And then you see that's like an over 90-something% recidivism, like you said, right? I can't even say the damn word. A failure rate, right? It doesn't work. Shit doesn't work, right? And that's why it's a revolving door. So I started looking into like all these other things to be like, what can we do to actually make a difference, right? So one of the things was with opioid crisis was Suboxone, buprenorphine, and that is a miracle drug, right? Like that is like over 90% successful. People get better on it, and people want to say like, oh, well, you're just trading one opioid for another. I was like, no, when we talk about addiction, part of what I do is I come from a harm reduction background, which means like I just don't want people to die from these medications, from these substances, right? I don't care if they use it or not. Like, you want to use heroin, go ahead, just don't die. We just don't want you to die.
I got a guy sell it to you. Shit, I'm joking.
We just it's like,
don't
please don't
say
die.
yeah to that,
thing.
doc. He said yeah. Jesus Christ.
I mean, but the thing is this, right? Is like I always kind of go off on like the harm reduction thing. Is that like in regards to like, we've had this, I won a damn medal in 5th grade from DARE for like an essay contest, right?
Okay.
And DARE's motto was just say no. And how well has that worked for anybody?
Mm.
And throughout history, it doesn't work, right? Throughout all of human recorded history, there's been substance use.
Yep. There's
never been a time where humans have not used substances. So it's there and it's not going anywhere. And it's not going to go anywhere. So we have to accept that like, this is part of our lives, right? This is what people will do. And if we just tell people, well, no, and if you use it, it's a moral failing and you're going to go to hell and that's your fault and you deserve what happens to you, like, what happens then, right? But once, white people in the suburbs start dying during the opioid crisis and people are like, oh, we have to do something now, different discussions occur, right? And now it's a crisis, and now it's a health epidemic and emergency and all this stuff that goes on. But Suboxone, again, buprenorphine, it's the thing that saves these people's lives. Like, I've seen literally people come in, you help them out, and like a week later, they're functioning in life. They're doing everything they want to do in their life. And because it's the addiction, it's all the behaviors that come along with this to support the physiological dependence that comes along with substance use, that's where the problems come from. So if you knock that out, people don't have to be stealing stuff or robbing people or doing X, Y, and Z illicit stuff to support their habit, then you're fine. And then all the problems kind of go away per se.
I know
So
it's hard.
that's
I know
things.
it's hard to get into
Yeah.
them Suboxone doctors too, though, because there's only few in the state and this and that. So they don't make it easy to get into them damn doctors.
To make it hella easy to like, prescribe 120 Percocets a month, but like you try to get into like see a Suboxone doctor, and it's a huge thing.
It is.
So I mean, you can talk about like, I mean, there's a whole other podcast about like, the stigma that comes along with treating opioid addiction and alcohol use and substance addiction in general. That comes along with that. So I've had, all my patients, Suboxone patients, they'll tell me like, pharmacist gives me a dirty look. They're asking me why I'm picking this medication up. And it's like, yeah, I'm taking a medication so I don't have to illicitly use another substance. You should be applauding me. Say thank you for using this instead of me. And then the next person they'll hand 300 Percocets to and be like, sure, oh, here you go. And again, not to say that they're like, those people are not having legitimate uses for this stuff, but like at the same time, it's like,
Still,
we have to understand that. Yeah.
So what about them shots, man? You see anyone doing good with them alcohol shots? I forgot what they're called. I got some clients taking those.
Oh, Vivitrol. Yeah.
Yeah.
Vivitrol.
Have you seen it? I guess I'm asking these questions because a lot of folks that are neurodivergent, the comorbidity with addiction is extremely high, right? For coping, regulation, all that. So I got clients that are on certain things, Suboxone, that Vivitrol.
Yeah.
And I've seen it help, but then also, do they keep going and get the shot? Do they keep taking the Suboxone?
Yeah. And ultimately that's what the idea is. Like, so what I do for alcohol is what's called the Sinclair method, which is the same medication that's in the shot, the Vivitrol shot. It's an oral pill. And you take it an hour before drinking, and what it's supposed to do is interrupt the reward process that comes along from the alcohol.
Okay.
With the idea that if you're motivated to stop drinking and you behaviorally learn that like alcohol is not giving me what I need from it, it's not giving me pleasure or joy, or I'm not getting anything from it, why will I keep drinking? And that's part of what I do. And that works 60 to 70% of the time for people.
Okay.
Versus again, 90+ failure rate with like go to AA and detox. And ultimately, like all this stuff with like addiction, substance use is like, what is the underlying cause? Like what is the reason that somebody is using the substance? Is it depression? Is it anxiety? Is it untreated ADHD? Is it autism? Is it loneliness? Is it something else
Trauma
that's contributing to this trauma, right?
Hey, thanks for watching this video. Check out the full episode on our channel and anywhere you find podcasts. Also, remember to like and subscribe. Whoop whoop.